Dear student, good morning. Today we will discuss about the isotonicity of solution. Iso means same and tonicity is the concentration of only the solute that cannot across the membrane. Since these solute exert an osmotic pressure on the membrane is known as the tonicity of the solution. Now next is the isotonic solution. The isotonic solutions are those solutions when two solutions are separated by a semi-permeable membrane and there is no flow of water across the membrane. That is known as a isotonic solution. The buffer isotonic solution are those solutions which have same osmotic pressure as body fluid and which help in maintaining the pH and isotonicity of the pharmaceutical. Buffer solution is known as a isotonic solution. Simply the tonicity is the measurement of the relative concentration of solute particle on either side of the semi-permeable membrane. For example, inside the cell versus outside the cell. It is known as a tonicity. Tonicity determines the direction and extent of the water moves by the osmosis process. Now, we have to little bit discuss about the osmosis. The osmosis is simply is the diffusion of solvent through the semi-permeable membrane, such as the water always flow from lower solute concentration to the higher solute concentration until there is a unit balance is produced is known as a osmotic. Means the region of the movement of ion from region of lower concentration to region of higher concentration until the equilibrium is produced is known as a osmosis. Now next is the osmotic pressure. It is a pressure or a force that cause the diffusion is known as a osmotic pressure. Now next is a type of tonicity. The tonicity are classified into three categories: hypotonic, isotonic and hypertonic. Firstly, we will discuss about the hypotonic solution. The hypotonic solutions are those which have an osmotic pressure lower than the physiological fluid. For example, 0.9% sodium chloride solution. The concentration of solute is lower than the present in an isotonic solution, such as 0.2% weight by volume of normal saline solution or 3% weight by volume of dextrose solution. When erythrocytes are placed in a hypotonic solution, the water enter into the cell due to which the cell are swelled and burst, so thereby liberating the hemoglobin in hypotonic solution. Now second is a isotonic solution. The isotonic solutions are those solutions when two solutions are separated by a semi-permeable membrane and the solvent flow across the membrane, and that is known as a isotonic solution. Simply in turn, the solution having same osmotic pressure with the blood plasma or physiological fluid is known as a isotonic solution. For example, 0.9% solution of normal saline, that is isoosmotic with the blood plasma. Now the solute is equal to the solute inside is equal to the solute outside, and that attain the equilibrium is known as a isotonic solution. Now next is a hypertonic solution. The hypertonic solution are the solution which have the osmotic pressure higher than that of the physiological fluid or 0.9% of the sodium chloride solution. For example, 2% weight by volume of normal saline and 10% weight by volume of dextrose solution. The concentration of solute inside the cell is greater than the concentration of solute outside the cell. When the erythrocytes are placed in hypertonic solution, the water moves out of the cell. The water moves out of the cell to decrease the concentration of solute in the surrounding and continue to do so until the concentration of the solute on either side of membrane is equal, and this due to the continuous outward movement of the water, the cell shrinkage in the size that become wrinkled and crenated shape in hypertonic solution. So all these are the diagram of hypertonic solution, isotonic solution and hypertonic solutions. Now, why we are using the isotonic solution? The isotonic solution, when it is contact with the tissue, that may be result of there is no swelling, there is no contractions and there is no discomfort in the body, and so that's why the isotonic solution used with blood, eyes, nasal trick, other body fluids. Now next is the isotonicity and route of administration. First of all, subcutaneous injection. In subcutaneous route, the drug are administered below the cutaneous membrane inside the fatty tissue. So the isotonicity is required in case of the subcutaneous injection. Now second is a hypodermolysis. The solution should be isotonic and large volume. Third one is a intramuscular injection. The intramuscular prescribed solution are maintained slightly hypertonic, which facilitate to increase the rate of absorption, and that should be hypotonic to increase the penetration of the. Next is the intravenous injection. It should be isotonic and with large volume. If the solution is hypotonic, that cause the hemolysis, and if the solution is hypertonic solution, that may be administered slowly into the veins. The hypertonic solution are large volume which is administered through a cannula into the large vessel. Now next is the intrathecal injection. Intrathecal injection are also, that should be isotonic with the plasma fluid. Now in case of eye drop, the ophthalmic medication in the form of lotion, we have to be adjust the tonicity with lacrimal fluid to avoid the lethal effect in the applied area. So that should be isotonic with the lacrimal fluid, which decreases the irritations. The eye lotion also preferably isotonic with the tear fluid. Now next is a nasal drop. Nasal drop should be isotonic. Any increase or decrease in isotonicity may leads to the irritation of the nasal mucosa, so it should be isotonic with nasal mucosa. Now we will discuss the main topic, that is a determination of isotonicity. Means method to determine the isotonicity. There are two methods which determine the isotonicity of the solution. First is a hemolytic method and second is the colligative method. So firstly we have to discuss about the hemolytic method. In hemolytic method, when the red blood cells are suspended in different solution of the drug and the effect on these solution on the appearance of red blood cells are observed. Firstly, in hypotonic solution, when RBC cells are placed in hypotonic solution, the concentration of solute is less when compared with that of the RBC. Hence, the fluid flow into the RBCs, due to which they swell and burst eventually. Now, second is the hypertonic solutions. When the RBC cell placed in the hypertonic solutions, the concentration of solute is relatively high than that of the RBC. Hence, the fluid flow out from the RBC due to the result which cause the shrinkage and the RBC cell become wrinkled. Now, third is the isotonic solution. When RBC cell are placed in a isotonic solution, there is no change in the appearance of the RBC and there is no net fluid flow because concentration of solute in both the solution and RBC is equal, means there is no change in case of the isotonic solution. So, on the basis of these observation, we have to find out either the solution is hypotonic solution, hypertonic solution and isotonic solution. So, this is the hemolytic method which is used to determine the isotonicity of this solution. Second method is a colligative method. In this method, the colligative property which can determine the isotonicity of the solution among the methods, the depression in freezing point is most widely used method to determine the tonicity. According to the depression in freezing point method, when a solute is added to a solvent, the freezing point of solvent is decreases. So, the depression of the freezing point of blood is minus 0.52 degree Celsius. If the depression in freezing point of the drug solution is found to be minus 0.52 degree Celsius, the solution is said to be isotonic solution. When RBC are suspended in such solution, there is no change in morphology of the cell. So, the depression in freezing point of the blood is minus 0.52 degrees Celsius and the tonicity of the solution is compared with the depression in freezing point of the blood. So, by the colligative method, we have to find out the isotonicity of the solution.